My patient is fairly sedated. I'm going to begin the procedure. This thing that you see is called the dry shield. It goes in the patient's mouth. The bite block will allow the patient to stay open, and this whole shield will go in there and sit in the throat under the tongue, and it will do the suctioning. So it helps to isolate the teeth and also prevents anything entering into the throat accidentally. Open big, sweetie. Thank you. So that's how it's placed, and then you turn the suction on. You can take a close-up, and you can see how it isolates all the teeth properly. So your upper teeth are isolated and the lower teeth are isolated. Patient's very comfortable, and I can work on all the teeth on the left side at one time. So it makes the procedure go faster. I'm going to start working on the teeth now. One of the points of education that I want to let the parents know out there is, see, when the child after sedation procedure, when you go back home and the child falls asleep, for example, then if you observe snoring from the child, you can watch closely. The child is snoring right now. See that snoring sound? So you can easily address that snoring by lifting the chin up like that. See, the snoring goes away. The concept behind that is, whenever the neck is bent inwards like that, it causes the tongue to fall back in the throat and it blocks the airway. So the easiest way to open the airway is to lift the chin up. So put your fingers on the bony part of the chin and put your hand at the back of the head and lift the chin up. That opens up the airway. So this is a real easy technique that everyone can learn. If you see a child snoring, you can do this and then the airway opens up. Snoring is also an indication of a possible sleep apnea on a child or an adult. So you should always get it checked. If there is somebody who's snoring really hard or gasping for breath in the middle of their sleep, it's better to get a checkup done for sleep apnea.